Hi, this is Denise Dias. I'm from the K-State Research and Extension Johnson County office, and today's topic is Medicare Advantage. Is Medicare Part C right for you? Medicare Advantage plans are all approved by Medicare. These private insurance companies bundle up Part A hospital, Part B doctor or medical, and usually Part D prescription drug coverage into a nice little package. I like to say it's kind of like getting a combo meal at your favorite fast food restaurant. Everything's all there in one neat little box. Medicare Advantage plans work like an HMO or PPO, where generally you have to get your care and services from doctors and other healthcare providers or hospitals within that plan's network. If you go outside of that network, of course, you're going to pay a higher cost. So those are some things to consider when choosing an Advantage plan. Medicare Advantage plans are chosen based on your zip code and where you live. But just because you live in that zip code doesn't mean that all doctors, hospitals, and specialists are going to accept that particular plan. The only way to know is to check with each doctor and hospital system that you want to work with that they will accept that plan. Medicare Advantage plans typically have a deductible you have to meet each year. You'll also pay copays when you go to the doctor or pay co-insurance on certain procedures. You also are required to use a specific health system, and you might need a referral from your preferred provider or your doctor to go see a specialist. Just be aware that if you use any out-of-network doctors or health systems, you may incur the full cost. Many people choose a Medicare Advantage plan because hearing, dental, and vision are typically covered, whereas under original Medicare and some Medigap plans, you may not have coverage for those things. Older adults often choose a Medicare Advantage plan because it does offer a wellness program benefit. In other words, you can go to a gym or work out or get some exercise to help stay healthy as you age. When looking at Medicare Advantage plans, you'll want to look to see if they cover over-the-counter medicines. Some plans do, some plans don't. The only way to know is to do your homework ahead of time before you enroll in a Medicare Advantage plan. New for 2020 are Advantage plan benefits that include things like meal delivery, for instance, having meals delivered after you've been in the hospital. You could also get transportation benefits to and from doctor's offices and other home services that are designed to improve the beneficiary's health. If you are currently in a Medigap policy and decide to join a Medicare Advantage plan, you can drop your Medigap policy without any penalty or problems. But just be aware that if you drop it, you may not be able to get it back because you would have to go through underwriting and be approved by that Medigap plan again in order to get it back. Do you love to travel? If so, just know that Medicare Advantage plans are designed to work within a certain coverage area. If you travel outside of that area, you may not have the coverage that you need or want, and also you may end up paying out-of-network costs for those services. If you have more questions, feel free to email me at denise.dias@jocogov.org. I have been trained and certified by the Kansas Department of Aging and Disability Services to be a SHIC counselor. Johnson County Extension and myself do not receive any compensation for this service. Our goal is to provide you with research-based information so that you can make an informed decision about your healthcare needs. Thank you very much.